Assalamu alaikum. I'm Dr. Tahira. You're watching PTV World program Health is Wealth. Heart disease is the #1 killer in the world. We have so many people suffering from either ischemic heart disease or cardiac failure. But unfortunately, not all of them can go through surgery and don't want to go through surgery. There are other methods that are available but not so well known. But today we're going to discuss in detail about EECP, a very novel therapy that will help all these patients fight these problems without any invasive, painful surgery. Let's start another very exciting episode of Health is Wealth, and our topic today is extremely interesting. Why is it interesting? Because it is very different from the conventional methods of dealing with heart disease. We've spoken a lot of times about heart disease, about cardiac problems, and especially as it's winter, a lot of people are suffering from heart attacks. Why are they suffering from heart attack? How soon do they, reach the hospital? And once they reach the hospital, what are the options that they have? But there are few options available that they don't have to take surgically, so that they're not as scared, and there are a lot of people who cannot go for surgery for many number of reasons. So what solutions do we have for them? To discuss all of this in detail, we have a very esteemed cardiologist with us, Dr. Medhi. Thank you so much, Dr. Raja Medhi Sahab, for joining us today. It is a pleasure having you. You've been a chief cardiologist consultant at Benazir Bhutto Hospital as well, at PIC, you worked in Chakwal and many places, and now you're practicing here at your center in E11. It's a pleasure to have you and see your center. Now let us start with first things first. First of all, let us speak about why heart disease is so prevalent nowadays and why do so many people around us are suffering from it.
Thank you very much. Thank you for inviting me on your show. As you know that there are the cardiac diseases which are the #1 killer worldwide.
Right.
Worldwide, about 20 million people dies of these heart diseases, and in Pakistan 3 to 4 lakh people dies of these heart attacks and related. The most important factor which I come to know about our lifestyle and dietary habits.
Exactly.
We don't walk, we don't exert, we don't exercise,
right.
And only thing we are liking is diet, which is cholesterol rich, nihari pie, and
so our Sundays, our holidays, our festivals, everything is filled with such diet.
These cholesterol rich diet narrows our arteries, and when it is more than 70% of the total, the patient complained of angina, because the atherosclerosis process starts at the age of 20. At the age of, it's very alarming, and nobody knows about it.
Right.
It starts from the age of 20, and after that we have same lifestyle, the breakfast, the
our
dinners,
dinner is also full of parathas and niharis and salons.
Especially these
processed
foods are
these
are
also
rich
harmful.
with cholesterol and dirty meat and
trans
these
fats.
things. Exactly. These narrows our arteries, and the atherosclerosis process, the plaque become more early.
Right.
And if we add 20 years more, you come to know that at the age of 40, more of the people suffer from the heart attack.
Exactly. So what are the investigations that a 40-year-old individual should regularly go through? I'm sure all your patients coming to you, you must be screening them on a regular basis so that they know if they are suffering from atherosclerotic heart disease or not.
At least I explained to the people that 4 investigations are very important. Everyone should know about his or her blood pressure.
Okay.
The sugar levels, the cholesterol level, and the BMI levels.
Right.
Everyone should know about, because these things are the major which plays a vital role in the atherosclerosis.
So when you measure the blood pressure, how often do you need to measure blood pressure to to come to a conclusive diagnosis that yes, I'm suffering from hypertension? What exactly is the number for hypertension? If the number is beyond 120/80, how much till how much?
Very important question. As you know that high blood pressure is the major risk factor of heart disease.
Right.
It's the silent killer and father of disease.
Exactly.
If it's present, then one have double the risk of heart attack.
Right.
the normal blood pressure is 120 by 80.
Right.
And the upper one is systolic, then lower one is the diastolic blood pressure. And if the systolic blood pressure increases up to 150 and the diastolic up to 99. It's the pre-hypertension. One has to be very careful, and it should be controlled with diet or salt restrictions, exercise.
Right.
If not controlled and it's still exists, then you have to take medication. And once the medication started, then it should be continued lifelong, and it should never be stopped without doctor's advice.
But a lot of people, you know, in our part of the world, when they are busy in holidays or they go to, you know, it's wedding season nowadays, they stop taking the medicine. And as a result, they suffer from a, you know, episode of hypertension and then heart attack, and then they put everybody else in trouble. So can you, you know, speak about the compliance of taking medication for whether it is heart disease, whether it is for hypertension?
Lifelong medication in hypertension, diabetes mellitus, and all the chronic diseases are very essential.
Right.
Once it's diagnosed, whether it's hypertension, diabetes mellitus, then you have to take medication lifelong, and it should never be stopped. Sometimes patients make it half or take it on alternate days, or sometimes the patient may make a myth that when the blood pressure is high, then he or she has to take medication, which is wrong.
Which is wrong. Now, you spoke about the second investigation, that was HbA1c, to see if the patient is suffering from diabetes. Diabetes, we know, is a leading cause of cardiac myopathy as well, cardiomyopathy, and other problems where, you know, the blood supply is compromised to different regions of the body as such. So when you see somebody with high diabetes, how do you tell them that how important is it for them to monitor their heart also from now on?
Exactly, the diabetes mellitus is also the main risk factor for heart attack. It's the silent killer and mother of diseases.
Right.
And if it's present, then double or triple the risk for heart attack. Not only heart attack, but it also lead to chronic kidney disease, or myopathies, cataract, blindness, and some more complication, as you know.
Exactly. A lot of neuropathies. And
it should be well controlled, and HbA1c level should be less than 6.5 milligram in all means.
So it should be less than 6. Now, if we speak about the, you know, the cholesterol, you said it is very important to do this test. For example, the HDL, the TGL, and the LDL, the good cholesterol, the bad cholesterol, and the triglycerides. So what are the exact values? And then, other than dietary modification, do you put them on statins and fibrates? Do you suggest them this, and should they be taking this? And what are the ideal values of a good, you know, test for
the
this?
The cholesterol, there are 4 types of cholesterol.
Right.
First is the total cholesterol, and it should be less than 200 milligram per day. If someone has cardiac disease or myocardial infarction, then it should be less than 100 milligram per day. And second is the triglyceride level, and it should be less than 150 milligram per deciliter. And the LDL level, which is the most lethal bad cholesterol, and it should be well controlled up to 100 milligram per deciliter. And the HDL level, which is the good cholesterol, it should be more and above 50 milligram per deciliter.
So this was the lipid profile that we did.
Exactly.
So what was the 4th test that you mentioned? You said there were 4 investigations.
The BMI,
the body mass index. So you have to see that the body mass index, your weight divided by height square, should be not be less than 18, and it should not be above 25, I suppose, right? So it should be between 18 to 25. Now, if we go into a little detailed investigations, for example, if somebody suffers from a heart attack, what are the symptoms, the common symptoms of a heart attack? So chest pain, night sweats, what exactly are the symptoms? How quickly do they need to rush to the hospital?
There are quick and emergency typical symptoms are the severe chest pain in the chest.
Yes.
The chest pain is retrosternal chest pain, and it is diffuse, not pointing pain.
Not pointing to one
If someone explains that he has pain here,
that's gas probably.
It's not cardiac pain. It should be other muscular pain or anxiety or stress or this. This pain is referred from the chest to the left arm of the body, or to the right, or even both arms, and it should maybe transferred or referred to the neck, jaw, or back of the chest, or it may be referred towards the epigastrium of the body, and the pain is associated with profuse sweating. Patient complains of tachycardia and discomfort in the chest. सीने में जो बोझ पड़ा हुआ है, symptoms
So
like
when they
that.
say that they have a lot of, they have palpitations, the heart is beating too fast, they're sweating, are they also short of breath? They're getting, it is difficult for them to breathe during a heart attack. These are the typical symptoms?
Exactly. One must be investigated for all that.
Okay.
If even not complaint of chest pain, if someone
As an
complains
anxiety.
of dyspnea or palpitation or discomfort in the chest, or sometimes patient complains of pain in the epigastrium,
Right.
or even pain in the back, or pain in the jaw, or pain in left arm, or these are the atypical symptoms.
Okay.
And one must be investigated for that.
And once you know that you're suffering from a potential heart attack, do you advise to patients to keep an emergency kit where they can put some sublingual aspirin or have their Disprin at home and take it immediately to save whatever their life till they reach the hospital?
Exactly. Emergency kit includes the Disprin, and one it should be at home, and everyone should know about it, and the person should keep it with the wallets and ladies' purse or even the car. And it includes the Disprin 300 milligram. You should chew and swallow. And NGC tablets, sublingual,
nitroglycerine,
nitroglycerine tablets, and if patient not relieves by chest pain, then you have to repeat NGC 3 times with interval of 15 minutes.
Okay.
And the third one is the Deponent patch. You have to apply on the left side of the chest, just below that clavicle, collarbone.
Is that patch readily available in Pakistan?
It's short, I think. Nowadays it's short, and I request the concerned companies to please, it's an emergency thing.
Once they rush to the hospital and they're given, TPA and everything, and then they're advised an angiography or an angioplasty, right, where they see if there is any blockage and then they put in a stent. So what is your advice to people regarding angioplasty and angiography? Should they go for it right away?
Exactly. Nowadays, the emergency PCI is done in most of our cardiac hospitals, and even the Islamabad and PIMS or Rawalpindi or AFIC. And one must go within 4 hours to the hospitals in order to go for PCI, early intervention.
Okay, so percutaneous intervention is important, and you should not delay it at all. But Dr. Saab, we were speaking about this very interesting therapy that you have brought forward, and it's I have not seen it anywhere else, and it's very good because a lot of patients out there are suffering from cardiac disease, atherosclerotic disease, but they are not able to go for surgery, or even after going for surgery they have persistent symptoms. So can you explain in detail about this wonderful therapy that you're doing?
It's EECP therapy, enhanced external counterpulsation. It's basically non-invasive, non-surgical procedure for those patients who are reluctant for bypass operation, or the doctors refuses, or claim it as high-risk patients. In this, the cuffs, the patient lie down on the table, and we have to apply cuffs on the lower legs, thigh and around the buttock, and when it inflates and deflates, during inflation the blood pushes towards the heart and increases blood flow towards the heart, and in this way the new blood vessels opens, which are commonly or popularly known as collaterals or natural bypass. In this way, the symptoms of the patient like chest pain, dyspnea, discomfort in the chest, palpitations, bulge in the chest, and symptoms like that, they disappear within days.
So there are a lot of patients out there who cannot go for surgery because they're not fit for surgery. Either their blood sugar is not controlled, or their blood pressure is not controlled, or they're of old age, they can't sustain anesthesia or even undergo that due to fear or anxiety. So are these ideal candidates for this EECP?
All these patients who are refusal for bypass operation, or high-risk patients, patients with diabetes mellitus, patients with high blood pressure, patients with chronic kidney disease, cardiomyopathy patients, patients with sexual weakness patients, male sexual weakness patients, heart failure patients, they all are ideal patients for this therapy.
So
and
it improves
patients,
circulation.
Exactly. Patients with repeated chest pain after heart attack, or even after angioplasty or
Yeah.
even after bypass
Bypass,
operation, patient
yeah.
repeatedly complains of chest pain, discomfort or palpitation or say things like that. They are improved very quickly with this therapy.
So this is a very good and novel therapy where you're getting oxygenation to different limbs and different parts of the body where you need circulation. Just as you said, it helps with erectile dysfunction as well, and it helps with other conditions that are impairing blood flow. So why is it not so? Why don't we see it as often around us?
I don't know what is the mechanism, but it's cheap and it's long lasting and it's time consuming. It takes
Yes,
35 days.
right. Maybe that's
and,
why. Yeah.
But on the contrary, it's FDA approved.
Yeah.
Food and
Oh,
Drug
it is,
Administration,
yes,
it
very
has
good.
approved and certified it in
Right.
the early 90s.
Okay.
And the Bill Clinton, the ex-president
Right,
of the
yes.
underwent this
He did?
EACP. He did
Okay.
EACP therapy. Abdul Kalam Azad of Indian
Oh, the president. All right.
he also underwent this EACP therapy. And the most of our cardiac associations, the American Heart Association, American College of Cardiology, the European College of Cardiology, even the Chinese College of Cardiology, they all has approved this therapy.
And nowadays we have this that we have to be less and less invasive because it is not painful, it is not creating a wound, there is less chance of infection or falling ill after that. And it is very good that you said that in 35 days a patient comes, lies down for 1 hour, feels so much better after that they can resume their day-to-day activities and their daily work. And it's an anti-aging regimen as well because it's
Exactly.
causing this neovascularization.
There is no hospitalization, no need of admission, no bypass operation, no need of any stents. Patient comes for 1 hour and then he should follow his routine activities, go for the job.
And you mentioned it's like the physiotherapy of the heart because it is causing more and more remodeling, it is a remodeling of the arteries and neovascularization. So more and more oxygen and nutrients can reach the different places, right?
Exactly. The blood supply towards the heart is increased, thereby increasing the blood flow towards the heart, not only to the heart but also towards the brain, kidneys, lungs, and to the peripheries of the bodies.
So it's good for limbs as well. And
its whole body supply is increased, and all functions of the bodies are increased, thereby increasing blood flow towards the heart. And as you know that the blood contains not only the blood but it also contains the oxygen and the nutrients.
Yes.
And when these are supplied by this blood, the functions of the body parts.
So it is going to help in wound healing, in gangrenous situations, in these diabetic foot situations, and all sorts of problems where there is, the oxygen supply is compromised, whether it is narrowed due to smoking or cold or whatsoever reason.
Exactly. Yeah. As you know that there most of the patients with the diabetic foot, uncontrolled hypertension, chronic kidney disease, and even the stroke patients are approaching us, and they are also benefited from this.
Yes, and I think their paralysis also starts recovering better, right? Once the oxygenation of the entire body and the brain is better, then it gets more patent. We were speaking about atherosclerotic heart disease and ischemic heart disease, but you also said that it has a good role in cardiac failure. So what is the role in improving the ejection fraction?
Exactly. Most of the patients with cardiac failure with ejection fraction of 20% comes to me, and after completing the 35 sessions, I repeat the echocardiography of the patient, and most of the time it increases up to 40%. More than for some patients, it increases up to 50%, and most of the patients are improving with improved symptoms. The dyspnea are improved, their chest discomfort improved, their palpitations and their other symptoms are improved, and the patients follow their routine activities by.
And you have a lot of patients who have already had these procedures, for example, an angioplasty or a CABG operation, and then they still come to you so that they can keep improving on their function, right?
Exactly. Patients, most of the patients come to us even not only from Islamabad but from far-flung areas, even abroad people come to me that after CABG they still complain of chest pain and palpitation and dyspnea, and when we completed this EECP therapy, all symptoms improved.
So with EECP ECP therapy. Along with that, you advise to them lifestyle modification, as well as you put them on certain medications, right?
Exactly. We have to, I explained to the people that there are 3 pillars of treatment. One is this EECP therapy, which has to be continued for 35 days. The second is the lifestyle modification. You have to take the healthy diet, which is rich with fruits and vegetables and without oil and ghee and this and that, the things, oily things. And third is the medication, which has to be continued lifelong for hypertension, diabetes, for ischemic heart disease, and some of the medicine, as you know, that the antiplatelet medications are, so some for cholesterol lowering, some for angina patients. These has to be continued lifelong patient.
Right. And could you please also advise, the patients not to self-medicate, because every patient and his condition of the heart and the problem with his function is different. And a lot of people, what they're doing, they see that, oh, somebody else is taking the medication, I'll also take that. So can you please stress more and more that every case is different. He needs to consult with a very licensed, experienced cardiologist, get investigated for the same, and then take only the medication that is suitable for them.
Because as you know that every patient is different from the other patient, and every patient has or his or her individual complaints. Some complaints of chest pain, some has high blood pressure, some has uncontrolled diabetes mellitus, some has other complications. So we have to choose the medication according to the age, sex and complaint of the patient.
Yes. So when we talk about this EECP, you said that do you investigate them before and then during the treatment and then after the treatment as well? And then have you seen like noticeable difference right there that you can document in terms of the health of the heart and everything?
I have documented about 50 patients and I have compiled my data.
Okay.
Most of the patients are already investigated, and they have their angiographies and their echographies done by different institutions, where we treat the patient according to the need of the patient, according to the disease of the patient, and after that I repeatedly do echocardiographies, and after completing the sessions, most of the time I advise them to go for thallium scan.
Okay.
And to go for the viability of the myocardium of the heart, and it improved in most of the cases.
So you said a thallium scan after that would actually tell about it. What does echo and ETT and ECG or cardiac enzymes, do they have a role in all of these investigations? And that's only
most
if you
of the time the symptomatically patients are improved, and they are they don't like to go for any investigations, and if the treatment, the purpose of the treatment is to cure the patient's symptoms. They do cabbage or angioplasty to remove to treat their pain and symptoms. If someone is cured by this EECP therapy, he is happy and go for home.
Exactly.
Most of the time.
So when we talk about lifestyle modification, you said cessation of smoking, more and more cardio exercises, daily walk and everything. And then in the diet, you said you should have no processed meat, no refined flour, no trans fats, and more of a Mediterranean diet. What is the role of supplements? For example, do omega-3 fatty acids or coenzyme Q10, do these supplements help with the heart?
They may be helpful. The Q10 and the omega-3 are helpful.
Vitamin D as well.
Exactly, they should be. Especially the vitamin D is deficient in most of the, because we are not exposing to sunlight, and it comes usually from the sunlight, and everyone should take this vitamin D course for 6 weeks, 2 lakh units of injections or this capsule to complete this vitamin D therapy.
Right. What about patients with, electric circuit problems? For example, if they have arrhythmias like tachycardia or atrial fibrillation or flutter or whatsoever, does this also help in that in some ways?
No, in atrial fibrillation or flutter, it's not indicated.
Okay.
And it should be properly cured or consulted by the electrophysiologist.
Okay.
We have to treat the patient according to the need of the patient by medication, and EECP is contraindicated in these cases.
In those cases, it is contraindicated, but in all the cases where the the blood supply of those arteries are compromised or the pumping of the heart is compromised due to heart failure, then it is better to increase it, right?
Exactly.
And in cardiomyopathies as well?
most of the patient comes to me with cardiomyopathies with ejection fraction of 10%, 15%, 20%.
Right.
They are improved magically.
Okay, very
And
nice.
with their improved symptoms, patient sometimes complain that they even don't go for to attend the washroom, to bath. They complain of dyspnea, chest pain.
So even
and
after stents, it's okay to have them? Even
exactly.
And what about valvular heart diseases?
No, it's not indicated.
Not indicated in valvular.
valvular artery,
So-
whether it is mitral stenosis, especially the aortic stenosis
Or regurgitations.
regurgitation. It's not advisable.
So
in
for
this
all
case.
heart patients who are listening out there, if they have ischemic heart disease, or if they have had any sort of TIA, transient ischemic attack, or they are suffering from lowered ejection fraction due to cardiac failure, this is a very good therapy that they must definitely adopt, right?
Exactly, exactly.
And there is no
it's
age
advisable
limit.
in all these conditions, as you mentioned, that
Exactly.
TIA, stroke, cardiomyopathies, erectile dysfunction.
So do you have any very interesting story to share about some patient of yours? Or I'm sure you had so many patients, like how their lifestyle, how their life changed after they went through this therapy and how satisfied they were.
The patient comes to me even after 2 to 3 years. He has completed his EECP therapy, and he enjoys his life, and he was advised urgent cabbage by some of the institution,
yeah.
and he was not willing for that. He was not ready due to
Yeah,
any reason.
better many reasons, yeah.
But he comes to me that he is very happy. He is taking medication and he follow the routine activities. He
Okay.
goes for walk and for a healthy diet, and I too was very happy after seeing
That's
this.
very nice to
Yeah.
hear. It is a very rewarding experience
Exactly,
to
exactly.
actually change the life of such people and make them, engage in their day-to-day activities. You spoke about erectile dysfunction. If we switch from cardiac patients and speak about this problem that is being exploited by so many quacks out there with different kinds of formulations that destroy them completely, can you, shed light on this problem that is so common in our society because of problems of circulation that people are not able to perform as such, and then how this is going to help them?
Some patients come to me with erectile dysfunction, not specifically for that, but they comes for cardiac disease, coronary artery disease.
And they're taking medications that are
Medication for
causing
that.
it as well.
I have completed this EECP therapy for 35 days, and the patient come to me that he had that problem with erectile dysfunction.
And now
that
it's better.
improves
Yes.
also with this EECP therapy. And there are so many studies, so many researches on these. The data is full of these so many in the Washington. There was studies on this erectile dysfunctions, and patients were improved with this erectile dysfunction with
Yeah. So we spoke about, a lot of people with joint pains. Nowadays, they are going for PRP, microneedling process, they're trying to increase the, by giving growth factors or increasing the circulation of that area, right? But this is the best method, I suppose. And you just suggested that a lot of people who went through it, they saw that their joint pain also improved due to the better circulation. Any such case that you can mention?
Exactly. So some of the patients come to me for this EECP therapy for coronary artery disease, and they explained me to after that he had a severe backache and joint pains. After taking this therapy, they are also improved by taking this therapy.
Okay. So when we speak about your advice to a heart patient, what if somebody comes up to you, what would you tell them? Like, how they need to monitor themselves? Like what are the symptoms that they need to look out for in cases of heart disease or TIA or stroke or if something? How they need to manage their weight? What should their lifestyle be like? How often should they visit a good cardiologist and see? And what are the investigations? You already mentioned the investigations, but how regularly, how important it is to see a cardiologist?
The one who complains of chest pain, he should consult cardiologist.
Okay.
If someone has dyspnea, he should also consult shortness of breath due to any reason.
Right.
It must be investigated.
Okay.
If someone had diabetes mellitus, hypertension, smoker, tobacco taking, and
Is obese,
overweight,
overweight.
he must be investigated for cardiac diseases. And most of the time, accidental discoveries Even patients don't know about the hypertension and
Right.
diabetes mellitus. These
Right.
are accidentally discovered. Patient come to you for other reason, and when you check the blood pressure and sugar level, they are very much increased. Patient
Elevated.
don't know about that.
Right. So what are the
So
symptoms of a blood pressure typically? What happens with blood pressure?
most of the time, 90, as you know that there are two types of high blood pressure, the primary and the secondary. In primary hypertension, 90% of patient has no symptoms, no
Okay.
cause.
Right.
Idiopathic these are. In 5%, some of the patients complain of this occipital headache, ho gaya,
Yes.
palpitation, tension headache, in some cases like sweating,
Okay.
the pain in these shoulders.
So the shoulders are tense and they
tense,
have headache on the back
these
of the
are-
head, so they can
these
go
are
and monitor
irre-
their
exactly.
blood pressure. And in cases of blood sugar, they can see if they are feeling extra thirsty or going to the washroom,
Washroom,
again and again, or
again.
their wound is not healing, repeated infections and all of that, so they can go investigate. These are the ones you said that they get accidentally discovered in terms of heart disease. But the major symptoms that you said we need to look out for is shortness of breath, sweating at night, or finding difficulty in breathing. And what about swelling? In cases of heart failure, do we get swelling and a raised JVP as well?
Especially the swelling around the ankle. Ankle
Okay.
edema is very common.
Very common.
Patient with palpitation and raised JVP or tachycardia. These are the typical symptoms of heart failure patients, and they must be investigated further for ECG, echocardiography, and further blood test to rule out any abnormality found.
So, Dr. Sahib, if we have a patient of TIA, a transient ischemic attack, maybe he has a history of, either heart disease, hypertension, or diabetes, but he had this attack where, he lost, and his arm got heavy, and he had a sort of a short paralysis kind of an episode. After that, do you suggest this to them so that they can prevent stroke as a stroke prevention method?
The stroke, basically the causes of the stroke or the TIA are high blood pressure, as you mentioned, the diabetes mellitus,
Right.
hypercholesterolemia, the cholesterol levels are high, and the tobacco. Tobacco,
Okay.
which
Smoking,
includes
yeah.
not only the cigarette smoking, it also includes the hookah,
yeah, the vape
swar,
and swar and all of that. Yeah.
e-cigarette,
Yes.
these gutka.
All of
These
it.
all are
forms of,
all
yeah.
forms are in which there is tobacco. It's very harmful for the. These are the main causes, and it should be well controlled to address this stroke and its further complication like TIA or this.
So this will help them in that
Exactly.
in
If you
detail.
control these, you have to prevent TIA and.
So when a patient comes to us for this therapy, after that, once they have completed that 1 hour, what is their, what are the post care that they need to follow?
They have to follow the lifestyle modification.
Okay.
Usually 40 minutes of walk a day is mandatory.
Mandatory. Fast, and should it be a brisk walk or heavy cardio?
It should, brisk walk is sufficient,
yeah.
and it should always be without taking any meals, with empty stomach.
Oh, so it should be early in the morning after Fajr.
Exactly, after
Yeah.
Fajr or even after Asr, that's also good time.
So you have to do a walk without having taken anything.
Anything. And third is the medication. Medication is also very important one.
Right. And we spoke about the diet. What kind of diet do you follow usually so that you can stay in shape and you can take good care of your heart?
I am taking diet without oil and without any ghee and this and that things.
So you're just baking without oil, everything?
Without oil.
Barbecue?
I have instructed my missus and all the kids and cook not to put any cooking oil or in the.
That's very nice. So what is the one advice you would like to give all our viewers out there regarding heart health and describing this wonderful therapy as well, and just so that they know that they have a place to come to in case they have any such problem? One advice to everybody out there, a message from you.
Take home message is that you have to take a healthy diet which is rich with fruits and vegetables. Take 40 minutes of walk with empty stomach, and control your blood pressure, sugar levels, cholesterol level, and obesity, and quit smoking, and avoid all oily and oily and cholesterol rich diet. I will end up with this small nazam in Urdu.
Okay.
कम खाना एक नज़म है जो इसके मुताबिक आपको अवेयरनेस प्रिवेंशन कम खाना वॉक और वर्जिश को मामूल बनाना कम खाना वॉक और वर्जिश को मामूल बनाना बीपी कोलेस्ट्रॉल घटाना सिगरेट को मत हाथ लगाना सेहत का ये दस्तूर सुहाना देखो यारो भूल ना जाना कम खाना
Thank you. So nice it was. And what he said was, eat less, don't smoke, eat right, eat healthy, stay happy, be positive, and everything will go your way. Thank you so much, Dr. Saab. It was such a pleasure meeting you. Thank you, Raja Medhi Saab. He's a cardiologist and he's doing this wonderful therapy that we spoke about in detail. And from here, we will actually be going and looking at the procedure happen right there in the hospital. And therefore, you can see with your own eyes how easy and how convenient it is to get this therapy. Let's go forward and look at it. Welcome back, and we spoke in detail about EECP, and here we are with a patient right here with Dr. Medhi, who's going to describe the procedure in detail now, because you know what EECP is now, why it is good, where it is indicated. But here we have a patient who's been taking this EECP for quite some time. Dr. Saab, for how long has this patient been on EECP?
Patient starts from day 1 to now it's 21st day of treatment.
Okay, so how long is this treatment?
It's for 35 days, continuous with two days break.
Okay,
5 days a week is mandatory and it's continue for 7 weeks.
All right.
Total of 35 days.
And how long does this one session last? Like for example, she's lying down here.
1 hour session daily for 35 days.
So 1 hour session daily for 35 days.
As you saw here that the jackets or these cuffs are wrapped on the lower legs, on the thighs and around the back of the body of the when it's inflate and deflate it's synchronized with the heart and during this process the heart push upwards and through push and pull phenomena this moves upwards and blood supply towards the heart is increased, thereby open the new blood vessels.
Okay. So right now what is happening is there are pulsations that are going from the legs, from the limbs and from the back as well. And you said that these pulsations are causing the blood flow in the arteries to improve?
Basically the blood flow from the lower side pushed upwards towards the heart and thereby increasing the blood. In this way the new collaterals, new blood vessels
will be formed.
And these acts as a natural bypass of the heart.
So it is a natural bypass. So what are the precautions before she comes here? Should she have eaten or stay empty stomach? Any such precautions before?
Same precautions as the patient underwent for ETT or angiography without taking any breakfast or wear the loose clothes and don't eat so much. Not so very.
So you have to stay NPO. So you have to come without food and water in the morning, or a light breakfast. Okay, so it's not completely NPO. You can come with a light breakfast and you can comfortably lie down here. The patient has no pain, no discomfort, and she spends 1 hour, meditating and in
peace. It's basically a non-surgical, non-invasive technique without hospitalization, without putting any stents, without operation and without any admission to the hospital.
So after 30 days of this entire therapy, do you start seeing the changes right in the middle itself?
Exactly, changes starts even after 1 week. Within 1 week the patient angina disappears, dyspnea disappears and the discomfort in the chest. Within days that disappears.
So the patient does not feel chest pain any longer, they can breathe easily, they don't have any...
Exactly.
And how do you investigate this? Do you investigate before, during the procedure, after?
Already the patient underwent for angiography, ecography and after completing these sessions we have to advise thallium scan of the patient to go for the dead area of the myocardium of the that becomes nourished, and because of the continuous blood supply enhanced, it becomes more nourished and with a viable myocardium.
So how many patients, Dr. Saab, have you had who have benefited from this miraculous therapy which not many people know about?
More than 1,000 patients I have seen this.
Very nice. And how many are undergoing this treatment on a daily basis?
8 to 12 patients are continuing here. We have 2 to 3 machines and start from 9 a.m. to 9 p.m.
Okay.
Continuous patients are coming
And then
from
once
far-flung areas.
very nice. So once they finish this 30, day period, when do they have to repeat it? Like after how much
If
time?
patient have no symptoms, then no need.
Okay.
If sometimes the patient comes after 2 years, 3 years with some complaints, and they come, they himself decided that they should go for this
Right.
therapy because it's
Makes them
just,
feel better.
no side effects,
Yeah.
no complications, and it's just a physiotherapy of the patient.
Exactly. It's a physiotherapy of the heart and exercise
and
of the heart. The heart is pumping externally.
It's basically the whole body supply is increased.
Is
Not
increased.
only the heart, but it's
the-
blood supply to the brain, to the lungs, to the kidneys, and especially the diabetic patients are very much improving with these facilities.
Also
And
this-
also the patients with heart failure and with the sexual weakness, with repeated chest pains, unstable angina, they all are benefited from this.
So are there any contraindications to this procedure? Like, patients who have some problem should not be here. Who do you think?
Exactly.
Yeah.
The patients with mitral stenosis,
Okay.
aortic stenosis,
Okay.
These and with varicose veins,
Okay.
these are not recommended.
These are
for
not
this.
the indications.
These are
But
not.
what is there any age limitation?
No age limit.
No
if
age
the
limit.
patients comes with the coronary artery
Right.
disease, with
Yeah.
one artery disease, with 2 vessel disease, 3 vessel disease, and the patient is symptomatic, then he is advised to underwent for.
You
this,
said it improves the blood supply to the different organs. So it must be really good for patients with, diabetic foot, with gangrene, and with such things.
Exactly.
Yeah.
Patients comes with us
Yeah.
with
Diabetic
diabetes,
foot.
mellitus,
Yeah.
uncontrolled diabetes,
Right.
and diabetic foot. Even sometimes the patients with paralysis,
Exactly.
facial paralysis, they improved
Because
with
the
this,
blood supply has
blood
improved.
supply has
And when the blood supply improves, generally also the lethargy and anti-aging properties,
the
glow
patients with
comes back.
backache. Sometimes the
Yeah.
patient, one of my patient in the other room shakes up from the Rawalpindi. He told us that he had very severe backache,
Okay.
and after about 20 sessions, that pain disappears.
Okay, that's very nice. So it is also very good for smokers, I think, whose arteries have really atherosclerosed and really.
It's indicated for all patients, I think. Even patients with no complaint, even the normal patients with old age patients with diabetes, hypertension, they comes and benefited from this.
So a lot of patients with diabetes, hypertension, and very old age who are not fit for surgery. Would you indicate this for them because they are not fit for surgery?
This is the ideal indication for those patients who are unfit, or sometimes the patient refuses.
Exactly.
That it's a
Yeah, it's
high-risk
too-
patient
and too expensive for some people.
And,
Yeah.
moreover, sometimes the patient also decided that he is
And they're not fit
because
for
of the fear
anesthesia
and
also. Yes.
fear
Yeah.
and expenses, and
Right,
they decided that
exactly.
they don't like
Yes.
this.
So there is no risk of like embolism or anything of that sort in this.
No indication, no risk.
No risk,
I have
because-
seen thousands of patients.
And there's never
There
been
is
any
no
sort of embolism, so
complication
there is
of that.
nothing, no complication.
One thing I mentioned, especially the patients with low ejection fraction,
Right.
the cardiac failure in the heart
Yeah.
failure patients,
Yes.
they are benefited, and their ejection fraction improves from 20% to even 40 or even 45, sometimes even 50%.
So it's basically like an external circulatory system that you have there.
Exactly. The more important is that the blood supply, when enhances, the heart works more efficiently, and
Right.
Also the ejection fraction improves from lower to higher side.
Thank you so much, Dr. Saab, for joining us today. It was a pleasure talking to you and learning about this very wonderful and miraculous therapy called EECP. As you heard Dr. Saab, he described it in detail. The patient here is also feeling better, as you can see from her face. And inshallah, by the end of the 30th session, she will be fit to, move about on her own. Thank you so much for watching us, and we'll be meeting you next week, inshallah. Allah Hafiz.